A new report finds Florida will lose out more than any other state for not expanding Medicaid. Studies show the state will miss out on $66 billion worth of Medicaid funding from the federal government.
This means more than 1 million Florida residents still can't afford the federal health care coverage the state has approved. TV 20's Stephanie DiNardo explains why so many people can't get insurance.
The working poor can't afford federal health care coverage, and they still don't qualify for the traditional Medicaid coverage since they earn more than the poverty level. One man in this group tells me state lawmakers need to do something about this.
There's no affordable way to get care that people need.
John David Feldman is one of more than 1 million Floridians who can't afford federal health care but still don't qualify for Medicaid. According to a report from the Robert Wood Johnson Foundation and the Urban Institute, Feldman could have afforded coverage if Florida had accepted the federal government's Medicaid expansion program. Now more than ever, Feldman says he needs help.
They found an enlargement in my heart and I'm not able to finish the testing that I need to get done.
But Feldman adds coverage would still be costly even with the Medicaid expansion, with a monthly plan costing up to $100. Some Democrats plan to bring it up in the next legislative session.
My hope that the Democrats and the Republicans can come together with some compromise to work to accept this $51 billion that will boost the economy, that will help the medically underserved.
Well, Representative Watson says taking federal dollars is the only way to help the uninsured. Senator Bradley says he has other plans for the upcoming legislative session.
Providing health care services has always been a partnership between state and federal government, but the federal government cannot continue to just dictate in Obamacare-style fashion a one-size-fits-all healthcare system.
Bradley says medical coverage cannot be a one-size-fits-all program, but should be based on individuals' lifestyle choices. For now, hospitals and people with insurance, along with state funds, bear the cost of medical expenses for the uninsured.
We have an obligation to provide an equal level of care to everybody that we see. So as an industry of safety net hospitals, we think about the risk because there isn't this long-term solution.
For now, people like Feldman are trying different things to raise money to pay their bills.
I've got an Indiegogo page and I did a preliminary fundraiser and I didn't get enough money, and so I'm trying to raise a little bit more.
The federal government has granted Florida a 1-year waiver for safety net hospitals like Shands, which will give funds to help the uninsured patients. But the federal government plans to phase out this funding by the end of the year. Stephanie DiNardo, TV 20 News.